Good morning, everyone. Happy day before Thanksgiving. I want to take a moment to acknowledge the individuals who are with us today. First is Chicago Public Health Commissioner Dr. Arwady. I also want to welcome Dr. Geraldine Luna, Medical Director for the Department of Public Health, and Dr. Alfreda Mena Laura, Infectious Disease Specialist and UIC Medical Director for Infection Control at St. Anthony's Hospital. We wanted to speak to Chicagoans today on a couple of issues as we head into Thanksgiving. First, to underscore our health protocols as we head into Thanksgiving weekend. Let me put this as bluntly as I can. We are extremely concerned about Thanksgiving weekend becoming a super spreader event. Despite the ongoing warnings from responsible leaders across the country, about 50 million Americans are still expected to travel this weekend. That is why we need to double down on our precautions in order to prevent a continued rise in cases, hospitalizations, and unfortunately, deaths, all of which we continue to see an uptick in. I'm urging you not to engage in your normal Thanksgiving plans, to keep it limited to your immediate household. While we have seen encouraging signs in our COVID-19 positivity rate, levels are still in the double digits and dangerously high. And we are still on track, unfortunately, tragically, for an additional 1,000 deaths by the new year just in Chicago alone. That should be a sobering reminder and figure for all of us. But what that number doesn't include is the broader impact this second surge of COVID-19 has on our healthcare system and also on individual lives. On the healthcare system, this includes limited hospital beds, staff, supplies, not to mention the long-term impacts on the survivors of COVID-19. You've heard some of these things, but let me emphasize them. What we are hearing here and around the world is survivors who have been experiencing ongoing challenges ranging from continued trouble breathing, fatigue, migraines, pain and numbness, dizziness, tremors, blurred vision, memory loss, and continued loss of smell and taste, and more which scientists and health officials are still working to understand. That is why we are asking every Chicagoan to avoid travel and avoid visiting someone else's home this Thanksgiving holiday and weekend. COVID-19 is being spread by people being close together in enclosed spaces. So please, pardon my allergies this morning, so please only celebrate Thanksgiving with those in your immediate household or remotely over the internet. And I know this is going to be hard. It's hard for all of us. It's hard for me. I expected to be celebrating with my 92-year-old mother and other family members. But that's not going to happen this year. It is the best way for us to protect each other and celebrate future Thanksgivings together. It is truly a sacrifice for sure, but in my mind, it's expression of love. In addition to that, I want to remind everyone that other features of our stay-at-home advisory remain in place. These include staying home unless you must go out for essential reasons like work, school, medical visits, food, or other essentials. Not allowing visitors in your house unless they're essential workers like home health care or education. Avoiding travel, and always continue to wear your mask when you're leaving your home. And of course, social distancing and washing your hands regularly. These are the things that we laid out as essential to protect Chicago and save lives. Save your life, save someone you love, and the life of your neighbors throughout the city. Let me also mention something else that is important for us to be cognizant of over the holidays. To put it mildly, this has been an extraordinarily stressful and traumatic year. And every year around the holidays, between Thanksgiving and New Year's, we see that stress amplified. And sometimes we see it manifest in ways that are destructive to individuals and to lives. Since I became mayor, I've been committed to addressing the violence that plays out in the streets every day. And I'm acutely aware that violence, in many instances, begins at home. And we have a crisis on our hands that has not been discussed nearly enough, but I want to highlight it here today. And that changes with the budget that we passed yesterday. Last year, the Chicago Police Department identified nearly 45,000. Let me say that number again. Nearly 45,000 victims of domestic violence. And we've seen a dramatic increase in the calls to the Illinois Domestic Violence Hotline since the start of this pandemic. Victims are requesting support and creating safety plans for themselves and their loved ones. They need safe, immediate housing. And this is something that we have to address as another public health crisis in our city. And that is why we are investing $1 million new dollars to address the issue intersection of domestic violence and community violence. The two are linked for victims, perpetrators, and communities. And the city, for the first time, must link them in our funding and our policy making. This is a first and critical step to the foundation my team is building that breaks down the silos and gets at the root causes of violence, including domestic violence. We cannot address the crisis in our streets without also looking to the crisis that is playing out in too many homes in our communities. But I do want to emphasize this. If you do not feel safe in your home, please contact either 911 or 311, and we can help you. We can help you with a plan to be safe. I also want to take a moment to thank the network, Advocating Against Domestic Violence, and its membership for its partnership and continued advocacy on behalf of victims. Domestic violence is something that we all have to acknowledge. We need to support the victims, and we need to do everything that we can to lower the temperature and to reach out so that people are safe in their homes. And again, this is particularly true as we enter the holiday season, which can add another layer of stress on an already stressful and traumatic year. Now I'd like to turn our attention to our city's plans for distributing the COVID-19 vaccine when it becomes available. First, I think we have to level set. We've seen some very encouraging news over the last 2 weeks about a vaccine being in the final stages of potential approval. That is incredible news. Make no mistake about it. However, I want to caution, and I'm sure Dr. Arwady will talk more about this, that widespread community distribution in Chicago, and for that matter nationwide, is still months away. Who gets the vaccine first and the order thereafter is determined by federal rules, not state, not local, but federal rules. Nonetheless, I want to take this opportunity to provide some details on our plans for distribution when a vaccine does become available. We have been preparing for this eventuality since the pandemic began. We didn't start with a blank piece of paper. We're building upon systems that have been in place for years when it comes to distributing other kinds of vaccines. Early in the response, we began working with our healthcare and community partners to increase our ability for quick distribution when a vaccine came online. And as we speak, our Department of Public Health is working with partners at all levels, including hospitals, healthcare providers, and community leaders, to ensure equal vaccine access through flexible programs that can accommodate different scenarios when that vaccine becomes more widely distributed, ranging from using large centralized sites, such as city colleges, mobile sites deployed at trusted community settings, and in high-traffic community areas with the support of the Racial Equity Rapid Response Team members. I want to stress that our projected timeline is still very fluid because there's still a lot of questions that need to be answered about which vaccines are coming online and when. However, we are expecting to have the first supply of COVID-19 vaccine before the end of this year. And now, while again, that is exciting news, per CDC and federal guidance, only a limited segment of the population will receive the vaccine first. This includes our frontline, high-risk healthcare workers and first responders, those people who are treating COVID patients themselves, and only a small fraction of those individuals will actually get the first tranche of the vaccine. Then that will be followed by especially high-risk individuals. And there are individuals with underlying health conditions, older adults living in congregate settings, among others, which will be in the queue to get the first doses of the vaccine when it moves beyond the initial stage. Though the timeline will vary depending on an array of factors, our goal throughout this process will be for everyone to be able to easily get a COVID-19 vaccine as soon as possible. While supplies will increase over time, at this point we expect all adults to be able to get vaccinated sometime in 2021. Until then, we have to remain diligent on the things that we know are the tools that will protect us, the things that we have outlined in our Protect Chicago campaign to prevent any further spread. Wearing a mask, social distancing, regularly washing your hands, as well as staying at home, avoiding travel, and again, canceling traditional Thanksgiving plans. We have to be in this together because we are in this together. The virus and the way that it spreads links all of us. What you do affects what he does. What you do affects what she does. All of us have to be in this together because everything that we do affects someone that we come in proximate contact with. We have to do this to slow the rise of cases, to bend them back down, to lower the percent positivity rates, to save lives, to save infections, and reopen our economy. Moving beyond this point, this crisis that we're in, to a brighter, stronger, healthier, and more resilient future depends on the personal choices that each of us make in this moment and every moment thereafter. So I'm urging you again to step up, not just for yourself, but for your entire community. Thank you. Dr. Arwady.
Thank you, Mayor Lightfoot, and good morning, everyone. I would like to start on this day before Thanksgiving by thanking the tens or likely hundreds of thousands of Chicagoans that have already made that difficult but correct decision to only have Thanksgiving with their immediate family, to not have others over, and not to travel. If we look at what's happening across the country, U.S. cases are surging everywhere. We are averaging more than 1 million new COVID cases diagnosed every week right now here across the country. And we have high concern for a post-Thanksgiving surge. I know many of you have seen the news coverage of the long lines at the airports, the many people who are continuing to travel. And unfortunately, when we're seeing numbers like this nationally, we know that COVID-19 is traveling with them. This graph here is actually data from Canada, and it highlights October 12th, which is the Canadian Thanksgiving. After the Canadian Thanksgiving, unfortunately, Canada saw a dramatic increase in COVID-19 cases. And let me tell you, the US rates of cases right now are much worse than Canada's was, and our potential for a surge is much greater. So it's not too late to change plans you might have even for tomorrow. Anything that we can do as a city to limit this risk here is a win for you, your family, and Chicago. Here is what our numbers look like right now. Here in the city of Chicago, we've now had more than 150,000 people diagnosed with COVID-19. And 15% of those cases have been diagnosed in the last couple of weeks are active right now. 83% of those people have recovered. More than 2% of those people have died. But if we take our almost 23,000 people who have active infection right now and have been tested, we know that there are between 5 and 7 times this number of cases if we include all the people who are not tested or do not have symptoms. And that means our estimate is that between 110,000 and 160,000 Chicagoans have active, meaning infectious COVID right now. And that means as many as 1 in 17 Chicagoans still has active COVID right now. If you've been paying attention, that's a tiny bit better than it was last week, where 1 in 15 Chicagoans had active COVID. But 1 in 17 Chicagoans, and that range is between 1 in 17 and 1 in 25, is at a point where it is not safe to gather and where we need everybody, as we have directed under the stay-at-home advisory, to be staying home unless it's for work, school, or essential purposes. If we look at our case numbers, we are now averaging still nearly 2,000 new cases diagnosed every day in Chicago residents. That's 6 times what we were seeing in September, 10 times what we were seeing in June. And we still have more than 1 Chicagoan being diagnosed with COVID every minute, assuming that we're testing 24 hours per day. And our test positivity, although we've started to see a little bit of early improvement, remains highly concerning. You can see in the darkest blue, these are our zip codes, particularly on the northwest, the southwest, and the far southeast side, that continue to be hardest hit by COVID. Positivity in those zip codes last week was between 17 and 26%. Everywhere in the city, every zip code, every age group, every race, ethnicity is part of this surge, and we need every part of the city to be part of bending the curve. I also want to highlight that we have not seen any slowing in our hospitalizations. And that's to be expected because unfortunately hospitalizations lag behind cases. ICU admissions lag behind hospitalizations, and then deaths lag behind that. Right now, there are more than 1,000 patients hospitalized, not in the ICU, with COVID-19 in Chicago hospitals. We have more than 300 more in the ICU with COVID-19. Both of those numbers are up 4 times just since early October and continuing to rise. And finally, COVID-19 deaths have risen 4 times just in the last 4 weeks since October 19. We're up to almost 100 deaths every week among Chicago residents. Even if this surge was done right now, we would not expect to see our deaths peak for several weeks. You may have seen the meme that's been going around Facebook that I think has a lot of truth to it. It's better to have a Zoom Thanksgiving than an ICU Christmas. It's true, and I want you to think about that as you're making your decisions, not just for Thursday, but for Black Friday, for the weekend that comes, and during the whole time that Chicago remains under that stay-at-home advisory, which does take us right now through the middle of December. Finally, I do want to add a little bit more detail to the vaccine update that the mayor gave. One thing that I am definitely giving thanks for this Thanksgiving is the remarkable good news that we've seen in early data from 2 vaccine trials. I want to be clear that we still do not have an FDA approved vaccine. December 10th is the date that the FDA has set for its first meeting to consider an emergency use authorization for the first COVID vaccine here in the US. We will be sharing, and this will be made public immediately upon conclusion of that meeting, the data that that team and the external experts will be using to make an emergency use authorization decision. There will be additional data related to the trial, related to the demographics of who was in this trial, related to side effects, and related to efficacy. The FDA will not approve a vaccine that is not safe, first and foremost, where we are seeing signs of serious side effects. And they will not approve a vaccine that is not at least 50% effective. The good news is that we've seen these 2 early vaccines look to be more than 90% effective, even 95% effective. That's amazing news because it means that with good vaccine uptake, we will sooner be able to get past COVID as a city. The Chicago Department of Public Health, as you know, has literally been planning for a vaccine since February. But related to this first vaccine, this is the one produced by Pfizer. If it gets emergency use authorization from the FDA, the CDC then meets in very short order, and there's a committee called the Advisory Committee on Immunization Practices, or ACIP. Again, independent experts who make the actual recommendation for vaccine. That committee will continue to meet as additional vaccines are put forward for possible approval, or if side effects emerge, or are there any other concerns related to vaccines that are already being distributed. And we expect that if the ACIP then makes the recommendation to begin vaccinating, we could be vaccinating here in the city of Chicago as early as mid-December. And we've got very specific plans for what that looks like. We've built up the ultra-cold storage capacity at the Chicago Department of Public Health. We're working with multiple hospitals that also have built some of that ultra-cold storage capacity. But every hospital in Chicago, for those highest risk healthcare workers, will be receiving vaccine and will be following up the uptake and continuing to focus on those highest risk healthcare workers. As you heard, after that, there is federal distribution of vaccine to nursing homes, long-term care facilities. We've got very specific plans here in Chicago, working with a pharmacy partner to vaccinate employees in those settings. And then we start thinking about our healthcare workers who see COVID patients in other settings besides the hospital. And it goes on from there. You'll be hearing much more about our specific plans as we're able to have more detail. But please rest assured, first and foremost, we're looking at the science. We will be absolutely transparent with you about what we know about these vaccines as soon as we know it. I fully anticipate getting a vaccine myself as soon as there is one that has been recommended that I should get by the ACIP. I know that this has been a hard year. This is going to be a hard winter, but I have every confidence, based on what we've seen so far, that 2021 is going to be a combination of rolling out a vaccine over months, pairing that with the things that we already know work to protect against COVID. And I know that here in Chicago, we can do this. We've already shown we can. We've got some early signs of progress right now. If we can hold that through Thanksgiving, through the early winter here, we'll start being able to pair that with vaccine, and we'll start being able to have much more hopeful updates on progress. So there's a lot to be thankful for this Thanksgiving, and I'm most thankful for every time one of you in Chicago thinks about your COVID risk, the risk for others, and how you can help protect our city. And with that, I'll bring up Dr. Geraldine Luna. She's one of our newer medical directors at the Chicago Department of Public Health, working exclusively on COVID, and she's going to do a summary of remarks in Spanish. Thank you, Dr. Luna.
Muy buenos días a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de la ciudad de Chicago. Esta conferencia de prensa se realizó por 2 razones. Primero, para subrayar nuestros protocolos de salud, mientras nos dirigimos al fin de semana de los días festivos de Acción de Gracias. Y segundo, para brindar una actualización sobre el plan de implementación de vacunas. Para repetir lo que dijo nuestra alcaldesa, estamos muy preocupados porque el fin de semana de Acción de Gracias se convierte en una gran propagación de casos. Es por eso que debemos redoblar nuestras precauciones para evitar un aumento de casos, hospitalizaciones y muertes. Es por eso que pedimos que, por favor, y lo pedimos encarecidamente, por favor, cancele los planes de acción tradicional, cualquier plan que incluya traer visitantes a su casa. Aunque hemos visto señales alentadoras en las tasas de positividad del COVID-19, las cifras de contagios son muy altas y, como dijo nuestra comisionada, hay 1 millón de casos cada semana a nivel nacional. Y si estamos hablando de Chicago, estamos hablando de 2,000 casos por día en Chicago y las muertes siguen aumentando. Todavía podrían haber 1,000 muertos adicionales para el final de año. Cada vez que usted piense en salir de su casa en estas Navidades o en estas festividades de Acción de Gracias, piense que puede traer al COVID-19 consigo a su casa, infectar a las personas que ustedes aman. Y ese número que estamos mencionando no incluye el impacto más amplio que tiene en el segundo aumento de COVID de nuestro sistema de salud. Eso incluye camas de hospitales, personal médico y suministros limitados. Todo eso se ve altamente impactado por estos casos positivos de COVID, donde nuestras reservas y recursos se pueden ver comprometidos. Es por eso que le pedimos a todo residente de Chicago no viaje, no visite, no salga de su hogar en estas festividades. La vida de la gente, la vida suya y de las personas que aman y los residentes de Chicago dependen de eso. El COVID-19 se transmite a través de personas reunidas en espacios cercanos. Así que, por favor, celebre solo con las personas de su hogar, el núcleo inmediato, y en forma virtual si tiene personas que no están viviendo en su casa, a través de la internet, a través de las plataformas. Sabemos que esto va a ser difícil, pero es la mejor manera de protegernos y celebrar juntos. Y como siempre, continúe utilizando su mascarilla cuando salga de su casa, practique el distanciamiento social y lávese las manos con regularidad. Estas preventivas básicas funcionan, ya han funcionado. Vamos a seguir. Y es así como protegemos Chicago y salvamos vidas, la suya y a las personas que usted ama y las de nuestra ciudad. Y en una nota muy positiva en este Thanksgiving, en Día de Acción de Gracias, es que ya estamos moviéndonos a distribuir la vacuna. Ya la vacuna del COVID-19 está disponible. Primero, la noticia recientemente sobre el desarrollo de esta vacuna es muy prometedora. Como dijo nuestra comisionada, la efectividad sube hasta un 95%. Eso es muy buena noticia. Sin embargo, aún faltan meses para la distribución en general en Chicago. Por ahora queremos aprovechar de esta oportunidad para brindar algunos detalles sobre el plan de distribución. Hemos estado preparándonos para esto desde el principio de la pandemia y ya está llegando el momento. Desde un principio, colaboramos con nuestros aliados comunitarios, con la atención médica para aumentar nuestra capacidad de distribución y está a punto de ocurrir. Y al momento, el Departamento de Salud Pública sigue colaborando con estos aliados en todos los niveles. Como le dijo la comisionada, ocupa ultra refrigeración y estamos trabajando arduamente para hacerlo disponible para todos los residentes de Chicago para el 2021. Estamos en conversaciones con los hospitales, proveedores de atención médica, líderes comunitarios. Queremos que quede claro que la cronología del plan puede cambiar. Sin embargo, esperamos tener el primer suministro de vacunas disponibles al final de este año para uso de emergencia. Vamos a explicar un poquito. Sé que la noticia es emocionante, pero según el CDC y las guías federales, solo un seguimiento limitado de la población recibirá la vacuna al principio. Esto incluye personal de la atención médica de primera línea de alto riesgo y trabajadores de emergencias, seguido por individuos vulnerables. Y por vulnerables estamos hablando de los que viven en la casa de cuidado de largo plazo o los nursing home. Y luego en el plan pueden variar dependiendo de una serie de factores. El objetivo a lo largo de este proceso será que todos puedan obtener la vacuna del COVID fácilmente y lo antes posible para el 2021. Las cantidades de esta vacuna van a aumentar con el tiempo y se espera que todos puedan vacunarse más adelante. Hasta entonces, debemos permanecer atentos a proteger a Chicago y evitar mayor propagación de contagios. Otra vez con lo básico. Use sus mascarillas, practique distanciamiento social, lávese las manos con regularidad. Además de quedarse en casa y evite, se lo pedimos otra vez, evite viajar. Y cancele los planes de acciones tradicionales que incluye traer personas que no son parte de su núcleo inmediato a su casa. Solo juntos llegaremos más allá de la crisis hacia un futuro más brillante, más fuerte y más prometedor. Cuídate, Chicago. Y ahora los dejo con el Dr. Alfredo Mena Lora. So now I'll leave you with Dr. Alfredo Mena Lora, Medical Director for Infectious Control at St. Anthony's Hospital. Thank you.
Hello, everybody, and thank you so much for your time. My name is Alfredo Mena Lora. I'm an infectious disease physician. I work at St. Anthony Hospital, where I've been seeing patients and working on COVID-19 response. And first, I want to thank our health commissioner and our mayor for all of their leadership and all of their work throughout this pandemic. And I want to thank you at home as well for staying safe, wearing your masks, and all the sacrifices you have done as well. I want to bring to light my clinical perspective and that of my colleagues seeing patients with COVID-19. And I think my most important message is COVID-19 remains very dangerous. Though patients and family members who are older of age are more likely to develop severe disease can happen in people of all ages. I've seen patients in their 50s with severe disease, patients in their 40s, 30s, and yes, even in their 20s. So with that, I want to remind you that this could be any one of your family members or neighbors, and in fact, it can be you, regardless of age. And this brings me to another point. About 40% of patients do not have symptoms at all. And this means they may spread the disease to others who eventually will develop symptoms and can develop severe disease. This too can be you or anybody around you. And that's why our mitigating efforts are so important. Wearing a mask, staying apart, socially distancing, and as we move into the holiday season, making sure that we celebrate Thanksgiving in a different way with our nuclear family, protecting others around us. This is why mitigation is so important, because it can be any one of us, and any one of us can also spread it easily to others. And it matters. As more cases come up, more hospitalizations, and tragically, more fatalities as well, more deaths. For us in the healthcare systems, as we see more cases, there are less beds, and healthcare systems can certainly become a little bit tighter in how we can respond. For healthcare workers, it's been a year of a lot of work. And this work is not just physical, it's emotional. We are there with the patients as they are critically ill, and try to be there with the family members as well. So there is a light at the end of the tunnel, as my colleagues were saying. There is a vaccine in the horizon, but we remain in the tunnel. And therefore, it is important for us to mitigate these risks as much as possible. In the months ahead, it will take months for these vaccines to reach all of us. And until then, we have to stay safe and stay strong. Throughout this year, I've been reminded of a poem by Carl Sandburg of Chicago, in which he describes the city as stormy, husky, brawling, city of big shoulders. Come and show me another city with lifted heads, singing so proud to be alive, coarse, strong, and cunning. These broad shoulders of the city are made of people like you, who are doing the right thing, making all the sacrifices. So please stay strong and stay safe. And with that, I want to also say my message in Spanish a mis colegas latinos en la ciudad. Yo soy el doctor Mena Lora y soy un especialista en enfermedades infecciosas. Y mi mensaje hoy es sobre la vista clínica de cómo COVID-19 se ve en los hospitales. Estamos viendo pacientes con enfermedad severa. COVID-19 sigue siendo bastante peligroso. Tenemos pacientes de todas las edades. Los pacientes de mayor edad tienen más riesgo a tener enfermedad severa, pero hemos visto pacientes con 50, 40, 30, 20 años de edad. Y ese puede ser cualquiera de ustedes. Puede ser su vecino, puede ser sus familiares, puede ser usted. Y por igual, hay muchos pacientes, aproximadamente un 40%, que no tienen síntomas. Y esas personas pueden transmitir el virus a personas que sí pueden progresar a enfermedad severa. Por eso es tan importante este Día de Acción de Gracias, de tratar de mantener nuestra mitigación usando máscaras y tratando de celebrar estas festividades dentro de su familia nuclear. Mientras más pacientes hay, mientras más transmisión hay, más casos, más hospitalizaciones y lamentablemente también más muertes. Pero podemos mitigar esto con todas las cosas que hemos estado hablando, máscaras y distanciamiento social. Hay una vacuna, hay varias vacunas que tienen muy buena efectividad en la información preliminar y todos estamos esperando que esa vacuna llegue. Y lo que siempre digo es que hay una luz al final del túnel, pero aún estamos en el túnel. Cuando llegue la vacuna, estoy esperando poder vacunarme y que mi familia también, pero hasta que llegue eso en unos meses, tenemos que seguir haciendo todos los sacrificios que hemos estado haciendo. Digo también que durante todos estos sacrificios me he acordado de un poema en inglés de Carl Sandburg sobre la ciudad de Chicago, que la describe como una ciudad de hombros fuertes que carga a todos. Y creo que todavía tenemos mucho que cargar y ustedes y nosotros tenemos que seguir haciendo lo que hemos estado haciendo en los últimos meses. Muchas gracias.
Thank you, Doctor. Thank you all. Happy to take your questions.
Good morning, Mayor. Happy pre-Thanksgiving. We've seen repeated requests by you, by the state as well, for people not to travel. Do you have concerns that this is frankly just falling on deaf ears?
Well, yeah, I guess the answer is yes, yes and no. I think a number of people are actually modifying and have modified their plans for not just for the holidays, but how they're living their lives day to day. I see it in my network of friends. I see it really across the city. And I think, as Dr. already said, it's never too late to do the right thing. But yes, when I see the crowds at the airport, now I will say that having spent some time talking to Jamie Reed, the Commissioner of Aviation, there was kind of a rush period, and then for most of the time at both airports, the traffic was fairly light. But look, we live in a time where, unfortunately, everything about this virus has been politicized. We've had a president who has spent an unfortunate amount of time undermining the severity of the disease, really impeding the federal response, bullying those governors and mayors who have stepped up to do the right thing to try to protect lives. So it's not surprising to me, unfortunately, that people are not adhering to the public health guidance. We, as part of our Protect Chicago plan, have activated people, I'll call them the ground troops, that are literally going door to door in neighborhoods. And some of the feedback that we've gotten from these early efforts is people saying, I had no idea that I lived in a zip code that had this high of positivity. I had no idea that I could have it and not have any symptoms. So there's a lot of education that still needs to be done over these next months, because that's really assuming that there is FDA approval for one or more of these vaccines. We're talking, deep into mid to later 2021 before a vaccine is available on a large scale. So we've got a lot of steps in this journey. The doctor said it. We see the light at the end of the tunnel, but we are still in the tunnel. So there's more work that we need to be doing every single day.
1 in 17 Chicagoans might have it. That number seems really high.
I agree with that. But that's why we've been talking about it. If you can, just point of reference, look at the number of cases that we were experiencing in early October, which is roughly the mid 200s. We're now a little better, but 2,000 cases a day, 10 deaths a day, 100 a week. We are not anywhere close to where we need to be. And I was reminded as I was listening to Dr. Arwady talk about asymptomatic spread. When I remember when I heard that as a possible part of this virus back in the spring, it took my breath away. And frankly, it scared me that people could be walking around with no symptoms but be carriers of this deadly virus. So yes, it is real, it is deadly, and we have to be diligent.
Question coming in from Telemundo for Dr. Arwady, and that is, with the CDC considering a change in their recommendations for the quarantining from 14 days down to, I believe it was between 7 and 10 days, is CDPH looking to modify that? And I will ask on top of that, how might this impact the self-quarantine travel order restrictions that you have in place?
Yeah, so certainly we are following those conversations and part of those conversations at the national level. There's not been a decision made at this point. We will continue to follow CDC guidance on this. So if there is a decision to make some alterations there, we would echo those. Let me put that in some little bit of context for people, though, just so we understand where that's coming from. It's recognizing the fact, first and foremost, that people typically are spreading disease in the 2 days prior to when symptoms start, and they're the most infectious right around the time symptoms are starting. We know that if someone has been exposed to someone with COVID and they get tested right away, that test will be negative, right? And so this is why you can't just test and your test is negative and you assume you don't have COVID. What we've learned is that most people who develop COVID do develop it in the 5 to 9 day period after that exposure. Right now, the quarantine period is 14 days because there are examples of people who don't develop COVID for up to 14 days after being exposed. But we really want to make sure people are able to follow the public health guidance. And as we've learned that there are fewer people still getting COVID at day 13 and day 14, there's been some thought about shortening that quarantine period to make it more easier for people to adhere to the guidance while still not serving as a significant spread risk of spread for COVID. So if there are national changes made to that guidance, we will echo those here in Chicago.
This may be a follow-up question for you as well. Kelly Bauer with Block Club asking, it seems that we're starting to see a slowdown in the positivity rate and in new cases just a few weeks after the state imposed the indoor dining restrictions. Do you think it's related? And do you regret not limiting indoor dining and drinking sooner?
No. So we really, as you know, each 14 days here in Chicago, we look at what our numbers look like. Are we in the red zone? Are we in the yellow zone? Are we in the green zone? And we make decisions about mitigation efforts based on what is happening here in Chicago. And I think, we have definitely put really throughout this pandemic, multiple times, we've put restrictions in place, often that are even stricter than the state. As the most densely populated part of Illinois, our risk is higher here, and sometimes we need to do that. I think where we're starting to see some improvement, that is a mix of mitigation efforts that are in place, as well as, I think, messaging. People understandably get more concerned when they are not just hearing that COVID numbers are on the rise, but increasingly they are knowing somebody who has COVID. Very different from a month ago. When we're talking about 1 in 17 people who have COVID in Chicago right now, there's a lot more people who are having immediate experience. And in that context, we do see people change their behavior, either because they're being required to quarantine or isolate, or they're just recognizing that this is here in my community and now. So I think some of that early improvement is a sign. This is how I'm, where I said I'm feeling, thankful that a lot of Chicagoans are doing the right thing. We just need to hold on to that progress and not see it all slide backwards over this time of gathering.
Last two questions.
Well, let me ask.
Before you ask the next question, let me just put a little finer point on that. We should not be blaming restaurants. That's not appropriate. It's not right. It's not justified with the data. And our restaurateurs, by mandate of local and state law, have some of the most strict health guidelines always, but particularly during this pandemic. What we've consistently seen and we've said is where we are most challenged as a city, I can't account for any other place in the state, but where we are most challenged is in those indoor settings, in homes, in private venues. And we put those restrictions in. And as the doctor already has said, I think it's a combination of things, but most of it is individual awareness of what their responsibility is, but also what their risk is. And so modulating individual behavior, biggest challenge in, I think, this pandemic, but we are starting to see, again, breakthrough. There have been people who understood it and got it and followed it from the very beginning, back in March. But as we saw over the course of the summer and we saw cases go down, people relaxed. And then this thing of COVID fatigue, I think, became real. We have tried now for 6+ weeks to really reinforce to folks, this is a second surge. It is real. It is still as dangerous as ever. And again, I think Dr. Laura really emphasized this point of what he's seeing every single day from a clinical perspective and how sick people are at all ages, all demographics. So I don't think we can or should, and certainly the data belies it, blame the restaurant industry. That's just not right.
If I have one more question, can I ask for a couple of more questions?
Go ahead.
I did have a couple more COVID-related
right,
questions,
that's
and part of this.
No, it's fine.
Becky Vivi is asking, how many Chicagoans have had COVID since the pandemic began and are potentially immune, and what might this mean for a vaccination?
That's a question for the doctor.
So just over 150,000 Chicagoans have been diagnosed with COVID. That is approximately 5% of Chicago's population. Again, we estimate that is an undercount and probably somewhere in the 25% range to perhaps 30% have likely been infected with COVID. The problem is the jury is still very much out in terms of how long and what level of protection comes after natural infection. And so we assume that for a period of some short months after infection, natural infection, there is some level of protection. But immune systems are notoriously fickle in terms of how much protection there may be, and especially people who may have had more mild illness or asymptomatic illness don't mount as much of an immune response. It has been clear that we are not going to depend on, this natural immunity or potential immunity. Even people who have previously had COVID will absolutely be offered and recommended to get COVID vaccine based on what we know now. And under a vaccine, that is a more measured way to know that we have immunity in a way that hopefully will last and will be protected. So what this looks like long term is mostly about our level of vaccine uptake overlaid with some level of what immunity we may have. But we're a very, very, very long way from so-called herd immunity via natural infection here in Chicago or really anywhere in the U.S.
I guess there's one follow-up question while you're up there, Doctor, if you would. Edie Quigg's wondering, we're seeing some improved percent positivity numbers. If this trend holds, how long before we might see the pressure eased on ICU numbers? And do you have any explanation for the drop in available beds around November 19th?
Yeah. So typically we see about 17 days between when we see, basically cases start first, if we sort of talk this through so people understand it. I get infected, perhaps right at the beginning I don't even have symptoms. My symptoms start to come, I'm sort of getting worse. That can typically take a week to 10 days, and we usually start to see hospitalizations really start to increase at the population level about 2 weeks after that surge of cases. Then if people are hospitalized, I mean, some people are sick enough they have to go right to the ICU, but we see other people continue to get sicker, and we usually see that ICU surge come about 17 days after, give or take, the surge in cases, and then deaths even follow on to that. So we're looking, right now at sort of mid-December as a, hopeful peak for hospitalizations. That would be if we can hold the very early progress that we have seen, and that's a big if. I think across the country, there has not been any signs of flattening at all. Hospitalizations are breaking records, and there's not going to be a lot of capacity to surge hospital staff, in particular, between regions. So the reason we're kind of, have sounded this alarm so strongly is that a unmitigated rise in cases does lead, inevitably, to an unmitigated rise in hospitalizations, and then ICUs, and then deaths.
Just a couple of quick off-topic questions for the mayor, if we could. Last two. Sounds good.
Well, let me just also say this, because it's come up in a couple of the questions that have been offered today. While we are seeing a modest amount of progress, I don't want people to fool themselves. We still have areas of the city where we have percent positivity that's over 20%. Over 20%. We still have neighborhoods where people are still getting sick at an extraordinary rate. So I want to be clear, when we talk about the aggregate numbers, there are still areas of the city that are very much challenged by COVID-19, and why we are activating this ground game, if you will, to make sure that we're reaching those people in those neighborhoods to connect them up with information, but also with services. Go ahead.
About domestic violence.
Yes.
The Tribune reporting this morning that Eddie Johnson, during the incident there, set some of his wife's clothes on fire, and there'd been a physical event before that. Do you have concerns this could be special treatment, and should there be charges in this case?
I'm not connecting the two at all. The general message, which we've seen over the course of this year, unfortunately, is a huge surge in calls for help to domestic violence hotlines. And big number last year. I'm worried about the number this year. And as we enter into the holidays, unfortunately, sometimes families get along, sometimes they don't. So I wanted to make sure that we were focused on this issue of domestic violence, because it is very real.
No, I understand that. Let
me just finish the thought.
Okay.
And we have put new monies into this budget that was just passed by City Council yesterday to really make that connection between street violence and the violence that happens in home. Regarding the allegations regarding Eddie Johnson, I don't have any new information on that. And I know that case, I believe, continues to be under investigation, and because of that, I won't comment further.
Your predecessor, his name has been floated around as a potential cabinet appointee in the Biden administration. Would you like to see Rahm Emanuel in the Biden administration as a potential advocate for Chicago?
I don't really have an opinion about that one way or the other. What I'd like to see is people who understand the importance of cities, that are going to stand up and support cities, that have the ability to rally people together and understand collaboration is critically important up and down, I guess, the chain of government. And the early stages of what I've seen as the cabinet picks roll out, it's very clear to me that the president-elect and the vice president-elect understand that his cabinet must reflect the diversity of our country, both in terms of race and ethnicity, but also in terms of diversity of views and perspectives. But number one, government is about collaboration. Government is about reaching common ground. And I want to see people in that cabinet who really understand that. So that's what's, to me, most important.
Thank
Concerned
you, Mayor.
about pardons by President Trump before he goes? Michael Flynn's name was
Well,
thrown
I'm
out.
concerned
string of
Last
others.
question, Craig.
I'm concerned about everything that President Trump does before Joe Biden takes the oath of office on January 20th. I think we've all got to be diligent. I know the lawyers are going to be diligent, and clearly there's going to be some things that are done at the end that aren't going to be advancing our democracy. I hope that's not true. I hope that the people around him are able to check what he does. We haven't seen any evidence of that in the last 4 years. But my focus is on the future and a new leadership in the White House that understands the importance of unifying and bringing people together. So let me just say, happy Thanksgiving to everyone. Please be safe. And we look forward to marching onward. There's many challenges that we must face as a city, as a state, and as a nation.
Thank
Happy
you, Mayor.
Thanksgiving, everyone.